Tony, one of the issues that was discussed this evening was the patient first paper. It's going to be a matter that's going to be discussed next month in Sault Ste. Marie. First of all, maybe give us a brief detail of what the paper is about.
Well, it's a discussion paper that's been put out by the Ministry of Health and Long-Term Care and Dr. Hoskins, the minister. And it's a consultation paper to look at different ways of improving health services, with the mandate being that we put the patient first, as is the title of the paper. It's another effort by government to look at bringing coordination of various health services at the local level to a much more integrated fashion. And so the paper itself has put out some suggestions. They're looking for feedback on those suggestions. The paper has posed a number of questions, and they're looking for feedback on those questions. So we're in the very early days of the process.
So what are some examples of the questions that they're asking, and what does this mean specifically for Algoma Public Health and what they're trying to accomplish?
Well, specifically for Algoma Public Health, in terms of the programs and services that we offer, there wouldn't be essentially any change. What they are proposing is that the public health units, not only in Algoma but across Ontario, be more closely linked with the LHINs. And through the LHINs, that there can be a better coordination of various health services, whether it be medical health services or mental health services. So the ways and means of doing that is part of what we're going to be discussing. And so it's very difficult at this point in time to really say exactly what that's going to look at. But that is the purpose of this discussion paper.
So there were a couple of questions asked by board members tonight. One of those was sort of a specific definition of roles. Who's handling the services and who's handling the budget, that sort of thing. Is there any concern there with those two topics?
Well, there may be. The ministry has indicated that they normally fund 75% of any public health unit board, and they have also indicated that funding will be at zero going forward for the next few years. So that will put some pressure on the municipalities in terms of, if they want a public health board to sustain the current services that they have, then they will probably have to increase their share of that budget. Having said that, the management piece that's referenced in the paper and that the board member asked about, my interpretation of that is that regardless of who is paying the bill, the ministry's position is that the public health boards themselves will manage the programs and services.
I think the other question that was asked by Ian Fraser was about, I believe it was about wages, and is this a concern with the local health unit, and is there any real concern about that issue?
Not to my knowledge, no. I would need to. I'm trying to recall the question, actually.
I think I believe it had something. It was something to do with finances or money, I guess.
It was probably something to do with finance. Yes. Well, there may be concerns about if the LHINs are going to be funneling the money from the ministry through to the health units, how that distribution model would work. The ministry has just launched a new distribution model which resulted in 0% increases. So it's the unknowns that are of concern, and the unknown is how exactly, if this goes forward with the LHINs and the health units work together in terms of how that money is allocated to the public health unit. That's the unknown.
Yeah, I believe you were saying that was in the discussion, or will be in the discussion stage with the municipalities.
That's correct.
Now, there's going to be a meeting about this on February the 11th about this particular topic. This is a chance for the public to learn more about it. What do you expect to see? Any reaction from that?
Well, I'm hoping that elected members of municipalities will show up. There will probably be members from different medical and social service agencies show up, because there's a lot of complementary programs between those, such as mental health and addictions. So my hope is that there'll be a good turnout at those consultations.
So what do you hope to see in the short term after all of this? This time, again, there's a meeting next month about this, and as you say, it's in the discussion stage with municipalities on a number of topics. What do you hope to see result so that things improve for all parties?
Well, I would hope to see a process that comes out of this that does see greater integration and or cooperation among the various health services. I have to say, in Sault Ste. Marie, there's a lot already underway where there is great coordination of services and great cooperation. So, if this paper, or if the results of this paper enhance that, that's great. I think the other major concern for all health units and for municipalities is the ongoing funding issues that the government has caused because of the new funding distribution model, which in effect is very heavily factored towards population density, and so that particular model disadvantages Northern Ontario, because, as everyone knows, the population in Northern Ontario is spread.
It's also an aging population. So, how confident are you that that things will work out, given the pressures that will likely be put on municipalities?
So, this is what we're hoping. Our association of public health units is definitely pushing back. Most boards have passed resolutions that have been sent to government that this funding model needs to be re-examined, because in essence, it's going to cause a reduction in funding to the units in the north because of the population sparsity, and that is going to make delivering programs and services much more challenging. And I think what we have to do is to remind government that when you're trying to deliver a program or a service at a distance in Northern Ontario, it's much different than trying to deliver a program or service in a major urban center such as Toronto or London or Ottawa.
How soon do you think we'll see some of the effects from this paper and its recommendations?
Based on past government consultations, I would say we're probably looking at 6 months to a year.
We should check back then to see if
Yes.
things improve or need to be further improved.
That's correct.